Man, it's tasting good. Pepper soup. Once you take a taste, pepper soup, you can't leave the place. Pepper soup. Once you drink that pepper soup, you can't get away. In Liberia, you got to stay. Fire! I hear you talking Liberia when foreigners come over here and drink pepper soup, drink pepper soup. It does have them spellbound and have them singing this song. Drink pepper soup, drink pepper soup. They don't want to go home at all when they eat swine with bitter ball. Uni, kuta aka, oh oh, it's pepper. Oh, oh, eh. You can't sit down, you can't lie down, you can't turn round, you tie right there. You can't get away. I say, what's the name of this soup? Pepper soup. Man, it's tasting good. Pepper soup. Once you take a taste, pepper soup, you can't leave the place. Pepper soup. Once you drink that pepper soup, you can't get away. In Liberia, you got to stay. Oh, yeah. I heard of this young man. He went to the motherland and drank pepper soup. He drank pepper soup. He couldn't understand why he could leave the land because of pepper soup. Drink pepper soup. It's the first time he eats so much mixture. Crayfish, crab, and barracuda. All kind of dry fish. They call swine. Oh, it's pepper. Oh, eh. He couldn't sit down, he couldn't lie down, he couldn't turn round. He died right there. He couldn't get away. I say, what's the name of this soup? Pepper soup. Man, it's tasting good. Pepper soup. Once you take a taste, pepper soup, you can't leave the place. Pepper soup. Once you drink that pepper soup, you can't get away. In Liberia, you have to stay.
You know,
The things are really trippy.
I this song, the more I listen to it, I honestly like try. They want my been to Liberia.
I
Like
think
you don't
so.
want to recommend it that song. She been to Liberia before because I'm listening to the song. I say, yeah, that's true. That everything they can put inside. The bitter ball, the fish, the what you know about what pepper soup?
You know, Nina Simone went to Liberia for 6 months during the heat of her career. She traveled to Liberia to rest. And
Yeah.
because she was that popular at that time, it's possible that other artists to follow. But I don't know if we have any history of
With her.
her. Yes.
Yeah. I think I would read more about her. Apparently she is still alive. But we're just
She was I think she was made an honorary ambassador. So there must
man.
have been some really close ties with Liberians or wherever she was.
Well, I love the song. The Calypso Rose, Pepe Sue. And she knows a lot about it. So good evening, ladies, and welcome. And thanks everybody for tuning in today. We have yeah.
Oh, there you go. Because you were frozen for a little bit.
Matia, y'all forgive me.
Tell your people to not act up tonight.
I can be worried about the LEC, but I can forget about the internet. But let's say a prayer that LEC will actually stay on. But thank you so much for joining. So today we actually have a special guest that will be coming on at about 9:30, Dr. Nicole Cooper, to just kind of talk about her new clinic that she opened, and also to answer some questions about the vaccine, because we recently received the Johnson & Johnson. Why are you laughing? We received the we received the Johnson & Johnson. You know, we had AstraZeneca here. So anyway, we'll get into that, kind of talk about it. There's still some hesitation about people taking it. So, you know, at 9:30, we will have Dr. Cooper on. Before we get to that, you know, we had some hot topics this week. There's a lot of things going on. Of course, the big news, big news. Congratulations to the team Liberia, the 3 athletes who actually
Yay.
competed in the Olympics, the Summer
Wow.
Olympics in Tokyo this year. Well, last week. And you know, there were 3. All of them were involved in track and field. And Emmanuel Matadi, he ran the men's 100. And then there was Ebony Morrison. She ran the women's 100 hurdles. But Joseph, both Emmanuel and Ebony did not advance. But Joseph Famile, he did the men's 100, and he actually advanced and came in 5th place with under, what was it, 20 seconds? I think 19 seconds, 19 seconds. 19 seconds, that fast. So anyway, congratulations, you know, for him going that far, making it that far. He's a young guy, 19 years old. So hopefully next term we can give more support, and you know, he has his whole career out. Of course, you know, as we were celebrating and all excited on social media, there were questions that came up about one, you know, is he really a Liberian? And then 2, why hasn't the government really provided any kind of support to the Olympics? We know that we do have a Liberian Olympics committee, which is headed, the president is Philip Brown. He's the president. And apparently he's been a president since 2005.
Oh, wow.
Yes.
You mean the guy who owns, what is it, the pepper? Doesn't he have a paper or something?
Yeah, he's a journalist.
Right.
Or reporter, yeah.
Yeah.
Yeah, he owned the newspaper, what, Pepper Bird or
Pepper Bird or something. Yeah.
Well, yeah, so he's been the president of the Liberia National Olympics Committee since 2005.
Wow.
Yeah, he was.
Do we even pay attention to it at all, Matu?
I don't think anybody really.
Would they pay attention?
Yeah, and I don't think we don't pay attention to. I mean, the Olympics, number one, the Olympics happens every 4 years.
Right.
Because there's so many other things going on. People attention span, you know, yeah. When the Olympics come, then we jump on.
We have the county meet that goes on every year. We don't pay attention to it. We have Africa Cup. We have the African Cup of Nations that goes on every 2 years. We don't pay attention to it. We have the World Cup that we don't even think about. And then with the Olympics, and they are not in Liberia. I mean, they have done well just by, you know, representing, just by identifying with the country, considering all the rigmarole about citizenship and dual citizenship and all that. It is a sacrifice for, you know, a young person to want to identify, because
the country,
depending on what country it is, there are times that this kind of situations put you in a place where you have to decide which nationality you want to be. You have to denounce one of them, you know. And the fact that they are representing Liberia is just a really, really big pat on the shoulder for them, for their career. Yeah.
To show that they love, you know, and our children is so hard because they're born here, but then, you know, because of their upbringing and so forth, their culture, what they learned about Liberia, even going there and visiting, they tend some of them take it very seriously. But then we sitting there, we fighting over the fact that, oh, you know what? You can't be a citizen.
It's just shameful that we have to be deciding on who is a citizen and who is not.
Right.
Exactly.
Considering that for a whole of our lives, we have had problems from one, civil conflict to the other. You cannot blame, someone trying to find, greener pastures for their kids, for their family to stay outside of the country. You cannot stop that. No. Since 1979, there has never been a time where we had stable peace, not even for 3 years.
Exactly.
You prepare your family. You don't want your family to go through what you went through. You want good schools, you want good hospitals, you want good roads for your family. And if you are able to, be provided with that in different countries, obviously you will settle in that country. Right. So this whole rigmarole about who's citizen and who is not, it doesn't matter where you're born. It's about where you identify. Because look at it, at the end of the day, they are carrying the flag. We were not responsible for how they've been trained over the years to reach how many hurdles they have to go through, how many, out of practice, how many personal pushes they needed to get them prepared for that level. Yes. Even for the designer who decided, last minute of time to be able to provide outfits for them, that would have been another hurdle they would have gone, over by themselves with their families, looking for money to buy, costume, the jerseys, or how you call it, their fitness clothing, looking for money for tickets and all the other different things. They are doing it out of their own will, and yet we're still at the back, completely criticizing about whether they are Liberian or not. As if to say Liberia has ever offered them anything. It has not. And even for their parents, probably not. The only thing they got for Liberia was probably they were born here and they know how to speak local. I think that's the only benefit you have so far.
Well, you know what? And I think the designer, Telfar Clemens, the Liberian American handbag designer. Yeah. I think the fact that he actually designed the outfit, it was for me, it was more than design the outfit. It was actually really giving Liberia that PR. Because all of us in the New York Times,
as a Liberian,
So and to see people on Facebook, oh, is he a Liberian? Really? Really, this is that they choose to even bear our flag and say, you know what, we'll go represent, and they represented us well. And like you said, Claudia, very well. A lot of the things that they do comes out of pocket. So it's almost like be thankful, congratulate them. But congratulations to Joseph Amulet, congratulations to Emmanuel,
to the entire team,
and
everybody was out there,
all the family members who went out there. The people wwho cooked the cassava leaf for them, I don't know who cooked cassava leaf.
I saw Ivika there.
So, but she checked cassava leaf. Wow. No, Ivika,
I don't know.
Yeah, but it was nice. It was really nice.
But yes,
but she enjoyed
embassy in Japan with Ambassador Nelson, Lamo Nelson. Yeah. It was also a good thing that they had a reception for them, welcome in a little way. Yeah. But we need to stop this dual citizenship business.
Yeah, you know what? We'll talk about this.
We need to stop it. It's an issue.
No, but I think people don't understand.
To come to Liberia after,
People don't understand the law. People don't understand. They don't understand the law. They don't understand the policy. People use it. It's this divide and conquer. And people will always, there will be certain people who will use it to their advantage to divide us. So it pays for it, you start talking about it.
It's beneficial for some people to say that.
And that's all it is.
That's what they want.
But
it's just ignorance. It's ignorance. Because if you even look at the great America that everybody runs to for solutions and all that, America in itself says it's a free country. You have all the different nationalities there that are still Americans.
Right.
You already here. You don't have anything for someone to depend on. You have people going outside to gain knowledge, gain experience, gain whatever skills they can to
And
come
bring it
back and
back.
contribute. And
Yeah.
then you say, no, you cannot accept them because they are not citizens. How do you define citizenship?
Yeah.
It's not a book definition. If
But
somebody
we'll
taking
leave that
someone stays
topic,
out for 50
Claudette,
years
because
and they
that's a
decide to
long,
bring the expertise back home, you
yes.
should be able to welcome them. Look at Ghana. The last few years, Ghana
There you
did do
get.
the return. Yeah.
Her
No, we'll leave
started.
that topic because that's a whole
We
show.
see all the other countries trying to go ahead and do things to get the qualified citizens, the skilled citizens, the athletic ones coming back to the country to give in. And then all we have to do is to just push people away by any means necessary. How do we expect to move from one place to the other if we continuously do that?
Yeah. Glad that we should do a show. We should do a show on that.
We are trying to get, we will do a show specifically on dual citizenship. So hopefully within the next week or two, we can get a lawyer on the show to honestly discuss it. And I personally do not believe this is a one show. I really think that because there's so many layers of this. So we will try to work that out within the next 2 weeks.
And we should bring, I suggest, Matu, we bring people from both sides, the people living there and people living here. And let us
not so much people living here, but people who believe in it.
We're born here.
Mindsets.
Yeah.
People that have the very mindsets.
Yeah.
We should say hi to our viewers so before they forget. Hello, everyone. I'm looking at the comments. Lorenzo.
Somebody's asking for Charlene.
Abdullah.
Salamartu.
Oh yeah, so Charlene is doing, she out ladder gagging. Unfortunately, Charlene couldn't join us tonight, so she'll be back next week. Yeah, but she's somewhere. And want to say good evening to Maria White. We see Aura. Hi, Lorenzo. Rosalind. Rosalind, she said my small. Everybody watch it. Very, very back soon. Keep on. So, but thanks for joining us this evening. So we're gonna move right into the next topic so we can get our guests on. The next thing, I don't know if you guys heard about, there was a protest on, what was it, Tuesday? And the only reason I even heard about this story was because of the protest that happened on Tuesday. There was a lot of traffic. And we asked why there was a lot of traffic. Then it told us, oh, the people are protesting by LNP, National Headquarters. And if anybody know me, by the time I hear protest, I literally can pack my thing home. But what had happened was that there was an angry crowd that gathered. They actually walked from Garnersville and they walked to the police station. That's a good bit of walking. They walked there because they wanted justice for a truck driver by the name of Aliyu Sharif. This guy died during a scuffle with 3 police officers in the Garnersville area. They said the officers actually stopped him for a routine inspection. I think most of us who live in Liberia, we know about these inspection. So he's in a truck, stopped him to do the routine truck inspection. And according to some of the eyewitnesses, this is coming from people who were just standing around watching, they got into a heated argument and the police beat him. They beat him. He was actually heard like saying, you know what, you're killing me, I'm dying. And they ignore him. So the guy dies. There were no statement from the police. So of course, the people got angry and they decided to march up there. But it wasn't just because of this incident. Apparently, there have been several incidents. There was one eyewitness said that they had beat one woman one time that her eye bore bust. So
wasn't there something? There was something
about
her mask.
Yeah, what they've been doing is the COVID inspection to ensure that the public is, they're trying to enforce the COVID health protocols. So they go
Right.
out and trying to make sure people are wearing masks, and they are beating people with sticks. They are asking people to pump tire when you don't have it. So it just kind of escalated. And I think when they killed this guy, people just got so upset and they went to the police station, which is so sad. One of the things I remember when the George Floyd case happened in America, most of the Liberians kept saying, you know what, at least in our country, we don't go through this. And when I read the story, I was like, oh, wow, is that where we're coming to? Now we got to worry about police brutality. We're usually worrying about police acting up for small something. Now, all of a sudden, now we got to worry about them literally like beating us, where somebody is crying and saying, I dying, and you're still beating them. And to date, the
They were
police.
investigating, right? They told them 10 days. I remember seeing all that on Stone, I think.
Yeah.
About from the day he said actually 10 days they needed because they're tired of not getting any result when they're investigating, quote unquote. So where are they now?
That's where we start and that's where we stop. We will investigate. And I think LMP did issue a statement saying that they're asking the officers to stop beating people.
What? I think that beating people started ever since. And the thing is, it's still going to go around circles all the time when you don't have people bearing penalties for their actions. Someone would beat, I saw a video one time on Facebook with, a police guy beating someone, I think somewhere in Logan Town area or in Nimba. And fortunately, one of these live streaming shows had one of their representatives there that put it on, that shared it on social media. And he beat the guy. He was running behind the guy because the guy didn't have masks on. Yeah. And I'm like, if this guy is affected with COVID and you're having all this interaction with him, what sense does it make in you trying to undo what you're supposed to be doing? Right. You got a person, you handcuffed him and you beating him. And it's something that has been going on gradually for a long time, and nobody is saying anything about it because at the end of the day, it's either someone who's popular in the police, someone who's well known. So when the news reaches headquarters, nobody say anything about it. It's just one of those cases, or you consider the citizen as one of the zocos, or they may respect me, so I had to teach him. That's how it starts. And we should not forget that we have a bunch of angry people already for different reasons, from not being able to afford daily meals, to not being able to have jobs, to just being angry about the weather and everything else. And the more we continue to do this, we are lighting a fire that we will not be able to cut off.
Exactly.
So the police really needs to stand strong. I must comment, had it been during the days of the former police chief, Gregory, I'm sure one complaint from a police officer brutalizing a citizen for any reason, that person would have been dealt with immediately. Right. And that's how it's supposed to be, because if people are starting to be afraid of police in the communities, then we are looking at the increase in crime rates. We are looking at increment in a lot of different untoward things that we don't need in the communities, obviously, because the police will also take advantage of people.
So Matu, I'm asking this because you're on the ground. So did they suspend these officers?
Nope. No, they haven't identified the officers. They haven't suspended the officers. They literally just issue a statement because the protest apparently got out of hand. The crowd got angry and they started throwing stuff at the police, and you know what the reaction was. So the police
will touch up.
department actually just issue a statement because, like I said, it did start because of the COVID. They were trying to enforce the COVID protocols to ensure that people were wearing masks, but they have been beating people, telling people to pump tire. And
yeah, they did that previously. They were doing it before, and I thought that they told them not to do that and use measurements. I mean, you can't just be going around beating the people,
Well,
and you can't do that.
the police say they urging the officers to stop that, and anybody who experienced it, they should contact the police, and that's the end of that.
But
So-
it shouldn't even be urged. Why will you urge them not to do it? It should be a straight rule.
It's
They should
part of
be
their policy,
mandated
and if you
not
do
to
it, you're
do
going to
so.
be suspended, and we're going to take you off the force. I mean, they need to do something
Yes.
large.
And
You
the thing
can't.
is that
It's a violation of somebody's rights, human rights
And it-
violation. You can't just be beating people. You can't do that.
besides that, the
I-
police,
I-
you cannot even identify the police except you already know
Exactly.
them. The police don't have proper identification. They don't have a seal number or a badge or something where if you can read, you'll be able to say, okay, let me identify them, get copy their number, or take their picture, and be able to track them down. You can't do that.
And then
I think I
They
saw a
shouldn't be
video the
out there
other day
without
with someone-
badges.
with
And they're
someone in a
wearing
police
masks too
uniform,
now.
and they asked him if he's part of the police, and he said he's half.
Oh,
Yeah, so he said he's half. They asked him, are you a police man? And he said half.
what do you mean by
What
half?
what have me?
He
Today you police, today you not police.
But you could also, because of where they're stationed, you could identify that police depot, right?
You should be able to
And
do
put
so.
the-
That's
their
why police
head
are
in trouble.
assigned in communities. There are zones, but I don't
Yes.
think that is possible now because the police are not. They are not identified. They don't have any kind of identification.
Oh.
So identifying them, I wouldn't know if this police is assigned to Zone 4, somewhere else, or he's
So I can
assigned
just put
to-
on
to
uniform
red
and
light.
go work,
They
right?
just wear uniform. So
I can put on
except
uniform and go work. I'm asking you.
if I'm a local in the area and have seen him around a lot of times, maybe out of friendship, I would know their name. But that's just a lucky case. Most times you don't know the name of the police officers.
And
I
a
don't even
man
know-
died.
no.
A man died. Somebody died.
So it's an issue, and people will be angry. People will continue to get angry until there is a serious stop to anything that is not, that's not supposed to be done. You can harass someone, you cannot beat someone, no matter what laws there are. The police is supposed to be able to arrest people and take them to the through the due process. So if you cannot do that, yes. If you 3 persons, why will you be beating only one man? You don't even know if the person is physically fit. You don't know anything about them. Your duty is to get the person, handcuff them, or take the details if you don't, if you think you're not strong enough to get them, handcuffed, take the details and then call for backup so that you can get that person arrested and take them to the station. It's not your duty to brutalize them.
Yeah.
Now it's an unfortunate
All right, guys.
situation.
Yeah, well, yeah, somebody lost
No.
a life.
Yes.
So there's a group that is
Mm.
actively following up with the police. So hopefully they can get some kind of redress.
Right.
So it's about 9:30. We want to invite our guests in. Dr. Nicole Cooper. Let me try to get her in. And guys who are watching, if you have any questions, please feel free to post it in the comment section. And we will do our best to get all the questions. Well, welcome, Dr. Nicole Cooper. How are you? I think she's on mute. You got
Hello, Salamartu.
How are you? How you doing?
I'm doing great. Good to see you guys. Thank you for having me.
Hi, Nicole. Welcome.
Welcome.
For joining. So for those of you who don't know who this young lady is one of our best doctors in Liberia. She is the chair of the Health Federation of Liberia. And not just the chair, you actually help formed this group in Liberia, the Liberia chapter,
Yes.
which was launched
Right.
last year. And
Yes.
so she recently opened her own clinic, the Wellness Partners Center. She was very much involved in the COVID response from the private sector perspective, the health sector. So I mean, she's been busy, I should say, within the last, I know within the last year during COVID, while most of us were scared, she's been extremely busy. But welcome to the show, Dr. Cooper.
Thank you.
Okay, so first we just want to kind of want you to talk about the Wellness Partner Center.
All right, so welcome. Thank you, everyone. Thank you for having me again. Wellness Partners Clinic was founded in May of 2021, or rather, I should say, opened in May of 21. It was founded last year, but opened in May of 2021. We are an outpatient clinic. We have me on staff. One thing that Salamartu did not mention, I'm not a PhD doctor. I'm a clinical medical doctor. And I have two medical specialties: internal medicine, which is adult medicine, and also pediatrics. So I am on staff seeing patients. We also have a general practitioner, Dr. Lorene Morris, who's on staff. We have a physician assistant, Mr. David Zumo, who's on staff. We have pharmacy, we have lab, we have some imaging, and we have a treatment room. So I try my best to maintain convenience for my patients. So if there is a patient that has a condition that is too much for just a plain clinical visit, but perhaps could be stabilized to avoid an emergency room visit or hospitalization, we put them in the treatment room and we try to stabilize them to see if we can turn around their condition in the next few hours so that they can end up going home that day instead of going to the hospital that day. There's several other things that we do, including US Embassy visa physicals. And one thing that I would say I'm probably most proud of is we offer discount plans for individuals, for families, and this gives access to some free and some discounted services for the duration of that membership plan. And they're very, very reasonable. We also offer similar discount plans for employers. You know, the types of employers that insurance companies either cannot accommodate because of maybe the size of the company, or maybe it's too costly for the company to do that. And apart from discounts for our employers specifically, we give them access to employer specific benefits like, you know, return to work forms for their staff. So your staff comes in and they're seen and they will get a form to show you that they were at the clinic that day, and this is how many days they need off, or whether they can go back to work that same day. These are the things that are quite important for an employer to know, not so much the protected private medical information of the patient, but more so from a human resources standpoint, is my employee safe to come back to work? Do they need any accommodations at work? Those are the types of things that we, you know, offer for our employers who are corporate members. So yes, the employers also get discounts and those types of conveniences to respect the fact that they are an employer.
Now I know one of the most needed services in Liberia is the health medical. And I guess this other question, why did you decide to start the clinic? Because I know you were at Chimali at first,
Yes.
right? Yeah. So why did you decide to kind of branch out and just start your own clinic?
So I didn't actually start at Jamali. I started as faculty, training pediatricians, which I still am part-time faculty, training pediatricians. And I started off actually at Redemption Hospital in Nukutown.
Oh, wow.
So you could say that I've really done the gamut, exactly, between absolutely no user fee care to the head of, you know, the top private facility, to also public health with the Healthcare Federation. I've kind of seen every part of the health sector in my work in Liberia. And one thing that I noticed amongst all patients in Liberia is that we all need high standard, reliable healthcare. We need to have trusted providers in an efficient system that delivers the same excellent outcome every single time. So at Wellness Partners, we're trying to remove that lucky ticket element of healthcare. That, oh, this is my doctor, and one day he's at this facility, one day he's at another facility, one day I'm able to get good care with him, the next day the other facility wasn't as good, or the nurse there wasn't as great, so something bad happened. I want to really remove that lucky ticket system. You need to know that when you go to Wellness Partners, you will get the same good care today, whether it's Monday, Tuesday, Wednesday, Thursday, Friday, no matter which day it is, no matter which provider you see. You may have a different level of care based on which type of provider, specialist, or general practitioner, but the quality will be the same. And you will not have a bad outcome happen to you because of silly mistakes, or because of carelessness, or because of poor standards of care. So that was one thing. The other thing that I noticed that was that patients need to be empowered to take care of their own health, right? Because there's nothing that I can do on maybe the 3 days that I will see you in a year that will hold you the other 362 days of the year that you're at home by yourself. So what you do when you're at home by yourself will have a much bigger impact on your health than anything I can do in the rare times in the year that I will see, a patient. So this is why at Wellness Partners, we say we are healthcare companions, because we're not the parent and we're not the patient, we're the companion. So we can give you guidance and talk to you about, what fits into your own lifestyle and your own parameters, but you have to own that when you leave the clinic. You have to take care of it yourself when you leave the clinic. The other thing that I noticed was that patients need a convenient way to pay for their healthcare. Insurance is not very common in Liberia. Less than 10% of the Liberian population is on health insurance of any kind. So this is not really what we're relying on. We don't have a national health insurance scheme. So patients need a convenient way. This is how we came up with our discount plans, right? Convenient way to have access to high quality care. So I felt a very strong calling to bring Liberia a healthcare solution that addresses these types of dilemmas. And that's what Wellness Partners is. We're providing innovative payment methods to allow patients to have access to this high quality, standardized care that takes their individual circumstances into consideration. So that's why I chose to open Wellness Partners. Nice. Oh, I would say that's how I was called to open Wellness Partners, because it's a very long story, but I always say that Wellness Partners was not my idea and I never would have done it, but for God. Definitely, but for God.
That ladies, do you have questions?
I think it's a really good thing. Congratulations again. Yeah, I left her on the way.
I was about to say, actually, one little known fact, Claudette was actually on the steering committee that helped form the Healthcare Federation. But yeah, she left us on the way, but we still appreciate the work that you put in the steering committee. It was helpful, and we thank you.
Yeah, I mean, the thing is, when you have people that see what you see, is easier working, to get something done. And most times in Liberia, especially with the health sector, is finding people that have the same vision. And especially for wellness clinics, I must commend you, because considering public health and considering our general lower knowledge of what we need to stay healthy, most times when you have patients in the hospital, just explaining to them how they're supposed to take their tablets is an issue. Explaining to them what diet they have to be on is an issue, and we have so many cases of diabetes and hypertension, and those are things that you can actually control if you have a wellness visit and people can explain to you, how you can live, how you can manage your life. So I think it is good. And number two, with the kids, pediatrics, people don't pay attention to wellness for kids. Yeah. It's a sad thing, because you don't want to see a baby sick, it's something that just sticks in your mind. And, having somewhere where people can take their kids, for wellness check to find out if they are growing properly, if they are having the right diet. is really good because parents don't even know, they don't even remember the name of medicines that they're supposed to give their kids. So sometimes when there are issues and you have to run to another health center and they like, oh, I give my child the pink medicine, I give my child the green medicine. It really does not help anybody. So
Oh, wow.
hopefully, I know she can do everything, but it's a great start. And hopefully we'll have other medical practitioners, that will join the bandwagon to make sure that the services are widespread. So thank you.
Clara, you made a very good point there about wellness when you said that people don't look out for wellness for children. I think that's because generally we see wellness as dealing with sickness, as opposed to taking care of yourself to prevent
Yes.
sickness. And so children end up going to after their 9-month vaccine, the next time they go to the doctor is when their skin is hot, they have malaria, or they're vomiting. Then nobody checks on them are they growing? Are they developing? Apart from just this vaccine, there's other things you need to know about this child.
Yeah.
Even for adults, they don't go to the hospital until, they fell off.
Yeah.
Or, something serious happens. They don't do, we need to really understand that wellness is not just dealing with sickness. It is avoiding sickness. So that's actually one reason that part of our membership plans, within that membership plan, once you sign up, you will automatically get one visit in a year for free. We want to make sure that everyone has that incentive, even if that's the only time in the year you will come, that free visit, at least you should come for that one visit. So you know what is going on with you. And we hope by encouraging them to come for that at least one visit in the year, they will start to get the idea of checking on things. Because once you go and you didn't think anything was wrong, maybe you discover something and you say, oh, if I wouldn't have come, I would never have known. So next time you know that you need to come. Next time you know that you need to come.
Robina, you have any questions?
Hi, Nicole. How are you? Congratulations on the clinic as well.
Thank you.
I've listened to you, and I know when I worked with Painesville City Corporation, we did health fairs, and it was free. Just to focus on how people in our communities could prevent, issues that they may have in the long run. Now, I know you're peds doctor, because most of my friends took their kids to you as well. Now that you've opened your clinic, have you been open to maybe speaking with the public hospitals to do a health fair? Maybe you all get together and do a yearly health fair where people who cannot afford to go to a clinic, or they don't know, because the problem in Liberia is we don't know what's going on with us. At least overseas, we have our 6 months checkups, yearly checkups, so we know how to prevent the illness from getting worse. So in this situation, have you ever, being that you've been in Liberia for the amount of time you've been there, have you ever done any health fairs with whether it's JFK, Catholic, to bring people in the various communities, to kind of check them out just for the basics, and then have them follow up with their doctors?
So
that was very political.
In short, yes, I have done health fairs before, specifically for Wellness Partners Clinic. Actually, at the time I founded and I registered Wellness Partners Clinic, I also registered Wellness Partners Foundation.
Okay.
Side by side. Because I knew that exactly what you said, there will be people who cannot afford it, despite what I do with innovation in financing and trying to have discounts. No matter what, there will always be some people who cannot afford it. So the goal of Wellness Partners Foundation is to have that philanthropic branch that will be able to do things like fairs, like health fairs, like outreach, and even at times, even outside of a health fair, if a patient comes to a clinic, a few times it has happened where a motorbike accident will happen just outside the clinic, and this person was not planning to go to the doctor that day, but they happened to land on the ground in front of our gate, and so obviously you rush them in and you try to clean them up and you try to do what you can for them. But in those cases, it is very difficult to claim any kind of billing or whatnot for that patient that had no intention of coming there. And as healthcare providers, you're also not going to see an unconscious person and ignore them, right? Yeah. So this is the goal of the foundation, is to be able to have grants, have projects that will give some amount of cushioning to allow us to be able to have those kinds of fairs without running the actual business into the ground either,
Okay.
right? So it's important, even as a medical practitioner, even as a humanitarian, to understand that you also have a fiduciary responsibility to your business. Because if you give everything out for free, your business shuts down and the other patients that were counting on you also have nowhere to go, right? So you have to do this responsibly. Responsibly for your patients and responsibly for your business. So that's why I founded the foundation in parallel, so that I could actually use the right method to make sure that that funding is available to do those kinds of things. So one thing that we have hopefully coming up, fingers crossed, we're still working on a lot of details with the powers that be, but hopefully coming up in the next few weeks will be a vaccine fair. So we're trying to get on the list, and I know that some vaccine, we're going to talk about vaccine in a little bit, but we're getting ourselves on the list as a vaccine distribution site so that we can do things like, for example, a Rotarian. That's another hat that I wear amongst all the hats that I wear on my big head. I'm also a Rotarian, so I want to work with our Rotary Club to have a joint event for a vaccine day. So this will be probably one of the first types of health fairs that we do.
Yay, thank you.
No, I like that. And I know you're mentioning the Healthcare Federation. People need to understand this is an organization that actually unites the private sector, the health private sector, in order to collaborate with the public sector, right? So I know we keep mentioning the Healthcare Federation, but that's an organization that just kind of organizes all the health, everybody in the health sector to be able to work with the private sector. But also there was a question about, do you do diagnostics or do you have a full lab, X-ray machines?
So we do have a lab, we have a pharmacy. Our lab does the vast majority of things that you would need for your general checkups or your follow-ups. And then we have, for pregnant women, because we do have an OBGYN that comes in once a week. For pregnant women, we have ultrasound during the pregnancy to kind of monitor the pregnancy. We work with an affiliated center to do our imaging, but we hope to have X-ray coming soon.
Good. Okay. And I know this is early, but you know, every time we have anything good in Monrovia, the first thing we want to say, are you plan on doing it outside of Monrovia? Are there any long-term plans?
It's not early. It's not early. It's not early. Actually,
Expansion.
Yeah.
Yeah, it's not early, actually. Wellness Partners is not a single clinic that will expand outside of Monrovia. Wellness Partners is actually an entire health system whose first location is the clinic that you're seeing now. So I never designed, or I always say I didn't design Wellness Partners at all. I did not receive this vision as a clinic. I received it as an entire health system that will cover the country and the Mono River Union, in fact.
Oh, wow.
But Rome wasn't built in a day. So yes, it is Wellness Partners is an entire system who is starting with one clinic, but that will encompass way more than that. Man can't talk all, so I will not say the full vision. You can't lay it out for everybody. But
don't lay out.
That is to say that yes, Wellness Partners is not a clinic that will expand. Wellness Partners is a health system that started as one clinic.
Nice.
So let me just ask this and make it easy. So obviously there would be family members that have families that they want to be members or they want to visit your center. And you talk about membership fee. Would you mind sharing what the membership fee is if I want to pay for my parents or I want to pay for someone else to come and get something like that?
Yeah, so the discount plans, you can have a discount plan as an individual. You can have a discount plan as a family group or as an employer group, right? And even if the family member, is not in Liberia, you can register your family member who is in Liberia. And one thing that we're launching actually this coming week is a partnership with an app called Own Your Health that will allow the family member that's outside of the country to do things like schedule the app will allow you to schedule appointments for your family member in Liberia to make payments on their behalf through the app. So we understand, this is what I mean by trying to make it as convenient as possible for people to pay for their healthcare. We realize there's a significant segment of this population who doesn't pay for their own healthcare. They have a benefactor somewhere who's helping them. It's hard. It's hard. You know, people have family members who care about them, who are sending them money, but at the time your family member is sick, it's not the time to try to get Western Union to them, or mobile money to them, or is World Remit, or is Cash App, or whatsoever working right now. You want to know that at the time your family member is sick, you already know exactly where they're going to go. You already have an account open for them there. All they need to do is just go. Right? When you get that phone call that's, you know, mommy is sick or auntie is sick, you want that reassurance. Say, okay, let them go to the clinic. Everything is waiting for them. Let them just go. You don't want to be outside and calling all over trying to get somebody. How am I going to pay for this? Do you have money? Can you send money to the house? You don't want to be doing all that in the time of crisis.
Yeah.
You want that person to just be able to go and know they're being taken care of. So that's actually something that's launching. I'll repeat the social media handles at the end, but that is launching this coming week. Just look for Wellness Partners Health on any social media.
So do
Wellness
you have I'm looking at numbers now. Do you have a range of what the fees are?
Yes. So I wanted to describe it first. Yes. So an individual discount membership for the year is $60.
Okay.
I think we all agree that's
a whole year, like the whole year.
A whole year. So for $60, you have your first visit with the GP is included. All of your labs and medications are discounted. All of your follow-up visits are discounted for the entire year. So as I said, we're trying to make it very accessible.
Ooh.
Okay. The app, the Caretaker app is an additional, I need to go back because we're just about to launch it, but it's an additional maybe $30 or $40, I think, for the Caretaker app for the year. So this is within reach, definitely. Definitely within reach.
So it's $60 for an individual. So
For an individual,
family.
yeah. So for a family of 5 or more, that $60 per person gets discounted to about $56 per person.
All right, thank you. So we'll be able to go, you said go to Wellness
Partners Health on Facebook, on Instagram, on LinkedIn.
And we'll be able to see that after you launch it. We'll see the.
Yeah, so that's coming up
you.
next week. So from next week, you'll be able, from tomorrow, you should be able to see the details on those.
Okay, thank you.
Yeah, very affordable. Okay, so that's the Wellness Center. We want to just kind of jump into the vaccine. You know, it's the hottest topic in Liberia right now. The COVID is the hottest topic in the world, actually. COVID vaccine. We actually had AstraZeneca here earlier this year, which requires the 2 shots, and we recently got the Johnson & Johnson. We do know that there are a lot of people who are still hesitant about getting the vaccine. I was able to get my vaccine when I went to the States in June, and I got Pfizer, which was, again, 2 shots within 3 weeks. But there's just been, I've been talking to everybody that I meet. Yes, we're wearing the mask, but this COVID vaccine, people are hesitant about it. It's a new vaccine, it's an experimental drug. So we just want to kind of ask a few questions to clarify. We trust your skills, we trust your knowledge on this. We know you to can't fool anybody. You're not working for the FBI to kind of trick anybody into getting the vaccine with all the conspiracy theories out there. First question that I wanted to ask was how safe are these vaccines? And we're looking at the vaccines that are currently in Liberia. So AstraZeneca and the Johnson & Johnson, just those 2 right now. How safe are they?
Okay, so generally all of the four major vaccines are very safe. So that's Johnson and Johnson, AstraZeneca, Moderna, and Pfizer are all very safe. I will not speak to Sinovac and Sputnik because the research behind those has been kind of kept behind closed, so we can't really testify on behalf of those two. But for Johnson and Johnson, AstraZeneca, Moderna, and Pfizer, the research has all been very open. It's been shared widely, and generally, they are all very safe. I say generally because all healthcare decisions need to be an individual decision for the safety and the medical history of that individual patient. But generally, overall, very, very safe. Very, very safe. And I want to talk about something that you mentioned, that these are experimental. This is true, that none of them yet have a full clearance. They all have experimental use clearance. And part of that just has to do with the length of time they've been in existence. It's not to say that it's labeled experimental because people have been getting sick or it's been causing problems. It's just that generally there's a specific time frame for which you have to have monitored it for it to get full approval. And COVID has only been less than 2 years. So it just has not reached that time frame yet. Although I believe I read this week that Pfizer is almost at the point of getting full approval in the US now from the time frame that it needs. Despite the fact that yes, technically it is emergency use, keep in mind that hundreds of millions. So that's really enough data for us to be able to see trends. If 5 people got it, maybe number 6 would be the one that'll have a problem. Yeah. But when hundreds of millions of people have gotten it, it really allows you to see the trend of safety or the trend of side effects, etc. And generally, they have shown to be very, very safe, including the two that we have here.
Oh, nice. So, Claudia, you have a question, and we'll go to Ripley now.
There are also concerns about the J&J. And in Liberia, I know that, well, I can't confirm now, but I don't know what the setup is for the vaccination. Are people allowed to sit off after vaccination for monitoring just in case there's an untoward reaction? Considering all the news with the Pfizer, is there any kind of education that the partners are willing to do from your side of the table?
Yeah, that's an excellent question. You must be a healthcare worker.
I'm a nurse.
Yes, that is an excellent question, and that is actually something that I'm advocating for very strongly, to ensure that we are giving our vaccines in a safe way. So the side effects, let me just go through a few side effects. First of all, the most common side effect of both of these vaccines is pain at the injection site, which is the side effect of any injection, right? Pain at the site where you got choked, basically. But with these injections specifically, apart from just the pain of the needle, they tend to leave your arm sore for a few days. That is the most common, reaction. Some people, though, for the next few days might get headache, chills, maybe even fevers for 1 to up to even 5 days. Some people, usually it's only about 2 days. Some people say they just feel like they have a light flu for a couple of days after getting the vaccine. Those are the most common side effects. Less common side effects are things like what you talked about, Claudia, immediately after getting the vaccine, getting lightheaded, feeling flushed, feeling dizzy for a few minutes. Within about 5 minutes, that can happen. It's not that common, but it can happen. Much less common are severe allergic reaction, meaning that my throat is closing up, my blood pressure is dropping, severe allergic reactions that need hospital-like interventions. Very uncommon. It happens, but very uncommon. And then the extremely, extremely rare cases, meaning like less than 1,000 out of the millions that have been vaccinated, are cases of blood clots that have happened with Johnson & Johnson and AstraZeneca. Extremely rare and pretty much isolated to a certain demographic of women under the age of 50 is pretty much all of the ones that got it. And even those, like I said, like less than 1,000 out of hundreds of millions who have gotten it. With the Moderna and the Pfizer, there are also very, very rare cases of people who have some nervous system reactions that cause muscle weakness and some forms of paralysis. Majority have recovered from it after a few weeks, but these are extremely rare, 1 in a million or less than 1 in a million type of reactions, okay? In terms of what you mentioned about are people allowed to sit and wait, it's because of that slightly less common reaction with the flush, dizziness, lightheadedness that can happen within about 15 minutes that I'm strongly advocating to have that waiting period. About 15 minutes after your vaccine, sit, wait, make sure you feel okay before you leave. And if you start to feel lightheaded, give you some water, some juice, banana to eat until you come back to yourself. And then we know that you're okay before we let you go. That is my recommendation. Once Wellness Partners is approved as a site, that will be my practice. I will not let people leave immediately after vaccination. Number one, I want to know that you've eaten and drank before you get your vaccination to reduce the
that was
likelihood
my
of
next
that.
question.
And number two, I want to watch you at least 15 minutes. We have emergency drugs on standby just in case. That is the safe way to do it.
Nice.
That
Ravina?
is the safe way to do it. I have not heard though of many instances. I have not heard honestly of any instances of severe vaccine reaction in Liberia, to be honest.
Yeah.
I have not heard of any. But
Okay,
I
I
also
think
don't know
I
if
had
our
kind of like the
population,
same question for her.
I also don't know if our population is educated enough to know that if something has happened,
With,
they have come from
you
their
know,
vaccine.
piggybacking off of Patty.
Yeah.
Is there a delay?
Yeah, Ravina?
Okay. Can you hear me?
Yeah.
Okay. All right. Yeah, I think Gladys asked the question that I was kind of leading
Yeah.
towards the Johnson & Johnson, the age group of the women, and how receptive are the people now? They've started vaccinating in Liberia, right?
Yes, they
Yes.
have.
This just started. Now
Latu?
I yeah, I had a someone who actually signed up to go. He went online, signed up to go and take the vaccine. And he received, instead of a confirmation saying he had signed up, he received a confirmation saying that his COVID vaccine card was ready, that he had already taken the COVID vaccine. And I think this is probably a procedural error. But I mean, he was just like, what? But he went and took the vaccine anyways.
So people are actually going in now and getting it done.
Yeah.
Okay.
Yeah.
I mean, majorly the problem with Liberia and anything that has to do with health is education.
Right.
You know, the more that we get information out there to people, especially for the vaccine, these vaccines have to be kept under specific cold temperatures.
Right.
Considering that we don't have all those things, it's important that we have health education done as soon as possible so that people can decide on, you know, what next steps they would take. If they don't know, they wouldn't do it. You know, if the doctors and the medical workers are not saying anything and they are only getting their feedback from the communities, that's what they will rely on, and that will be a major part of, you know, the results for the decisions.
And Nicole, I really like the fact that you are pushing the 15 minutes wait, and sometimes they have 30 minutes wait, I guess, for critical patients. So that's awesome. That's awesome to hear. I really like that.
So usually what we do is we start at 15 minutes. If something happens, then we add an extra 15 minutes and say, let's wait and make sure that, you know, you recover.
I think it's okay.
But yeah, in the UK, there's a 30 minutes mandatory wait. So you're not going anywhere until after 30 minutes.
Yeah.
They have guards to make sure that you sit.
Oh, wow.
Yeah.
That's good. That's good.
Yeah.
You don't want
There's
people
a
going
whole,
off
they
and
have
falling
guards
away.
to make sure that you sit and wait.
Yeah.
And yeah, even if you say you are okay, it's left with the health workers at the gate to look at you and find out if you're actually okay to let you leave.
Oh, wow.
So yeah,
because that could be
but I
bad
think
messaging.
it's important. Yes, it's important that we stress that people have, you know, their meal that they eat before they go to take their vaccine.
Right.
It's very important.
And taking Tylenol or paracetamol, from what I heard, because when I went to take my vaccine, they told me not to take it because she said it wouldn't really do anything. My vaccine wouldn't really kick in. I wouldn't really feel anything until after 48 hours. So Nicole, why is that?
I don't think so. But anyway, let her answer.
Yes, you're
No,
saying.
I don't think so. I know that would. Yeah.
You're saying they told you not to take Tylenol
Yeah,
at the time
yes,
because
they
you wouldn't
told
feel
me.
any pain yet until 2 days later?
Yes, going to the clinic, I said I would take a Tylenol because they called before going in. And they said, well, you know, you really don't have to take that because you're really not going to feel 24 hours. You really won't feel anything till after 24 hours. Sorry, not 48. So.
In short, I disagree.
Okay.
Yeah,
In short,
I don't think so too.
Yeah.
I don't
Because
think so too.
that's okay anyways, but that, yeah, that's what
exactly,
they
thank you.
said.
Maybe
For a couple of
Tylenol.
reasons.
Maybe
Yeah.
Tylenol. I know that for
Yeah, I took
vaccines,
my
even for
Tylenol.
kids,
Mhm.
just for general vaccines, you are asked to give them
To take that, yeah.
paracetamol.
Yeah.
Because obviously you will have pain, even if
Yeah.
not for any kind of reaction in your body.
Yeah.
It's just the fact that you are getting that injection
pain.
into your skin, you will have
Yeah.
pain.
Yeah.
So
Right.
yeah.
So there's
Oh,
So
thank
most
you.
times you are advised to at least take the paracetamol 30 minutes before your
Sure.
inoculation, so that it helps you, not get so much pain.
Okay,
Somebody
well, I
asked-
had a question regarding, because I read somewhere where we might need to get a booster,
Yeah.
the Pfizer people,
Pfizer.
that we might who might need to get a booster. So of course, then the question becomes, how long does the vaccine, how long does it last? How long are you immune?
we don't know. The
Don't know.
answer is that we don't know.
Yeah, because we have expiration dates, remember, on our
Okay.
thing.
Oh,
No, I think
I mean, after you,
asking how long does
After
the
you
vaccine
take it.
last
Yeah.
within your body?
well,
How
you
long
know,
are you
Okay.
because if they're
The
talking
short
about
answer is that we
booster,
don't know.
yeah, that means,
I can tell you what we do know. What we do know, I think the country that has the most data about this is probably Israel, especially about Pfizer, is probably Israel. Israel launched a mass vaccination in January of 2021. I think by now they've covered about 80 to 90% of their adult population. So now they are at 8 months out. And now Israel is starting to see rising cases again. Now, part of that is because when they vaccinated and they had a huge drop in cases, that was before the Delta variant existed.
Yeah.
Now the Delta variant exists, even though they use Pfizer and Pfizer still has very good protection against the Delta variant, there's now questions and the research is happening to try to figure out why are the rates going back up. Because they should have every level of protection with 80 to 90% vaccination rate in adults. They really should not be seeing this rise again.
Yeah.
They're trying to understand why they're seeing this rise. If it's as effective as we think it is against Delta variant, then it shouldn't matter if it's Delta variant, right? So now the question is the immunity waning already? Do they need a third dose? Is it that it's not as effective against the variant as we thought it was? Is it that the children are the ones spreading it, who are not vaccinated are the ones spreading it? They don't know. They don't know. So there's a lot of research going on. The short answer is we don't know how long it lasts, which is why I say don't count on your vaccine to stop you from getting COVID. Okay. What we know the vaccines are very good at is stopping you from getting severe disease, stopping you from dying. Wear your mask, wash your hands, try to stay away from crowds. That will stop. That will stop the spread.
Yeah.
Well, I've been reading. And yes, I'm interested in academics.
What did you read, Gladys?
Yeah,
I have
what did you read?
Science journals and data. Now I've got a master's in epidemiology. So for these kind of things are our area. So I have taken my time to read as much as I can on science journals and data. And I have not come across any kind of paper, any kind of scientific information yet that has any kind of evidence that the vaccine immunity has been longer than 4 to 8 months. That's the breach that has been in.
But
So
could it be because again, this is a new
It's only
now,
been in
yes,
existence
And it
for
one
has
could
to
be,
settle.
yes,
Yeah.
so you can't
one
have
could
any
be,
Build
data
an
longer
immunity
so
than
for
that.
it.
there shouldn't be any data really that
Yeah.
shows us that it's longer than that. We're
one
literally
could be
in the
the general
experimental.
population. The general population did start to get it within that time frame, but there were also pilot population
Uh-huh.
at the end. There were pilot population, so that data has not been made available, and that is my issue with the vaccine. Until that data is made available, the pilot data, I'm interested in the pilot data. So that I know that a month or two, maybe like 6 weeks ago, the first Pfizer vaccinated person died. He was an elderly man. It was on the news, but there wasn't any other story, probably just of age and not anything else. But obviously, with the immunity, there are a lot of things that contributes to one's immunity besides you getting the vaccine, your way of life, your diet, your health status, and all those different things. The big thing is, I think, people should just understand that getting the vaccine does not make you invincible. And I think that's where a lot of the
The
problems is
virus.
coming from with the spread and the resurgence of the rate of COVID. Most of the people that I see, my peers and stuff that have been vaccinated twice, they just feel that they have green light to party anytime. So they don't wear their masks, they don't wash their hands, they just go about anyway, anyhow, because as far as they are concerned, they have, been double vaccinated and they have immunity. And even with the vaccine, it still does not work that way. So you take your first vaccine. Now there are studies that says that your immunity or the vaccine doesn't really kick in for the second time until it is at least 8 weeks after your first dose.
Right.
So there are people that were getting their doses in shorter time frame that may not be, except you go to the hospital for them to really run your lab to find out if you have developed resistance or if you have developed immunity, what they call it, antigen or
Antibody.
antibodies. Yes,
Antibody.
antibodies. You will not know. So you would think that you have immunity, but you may not have developed immunity. Even after the second dose, you still have to wait for a period of, I think, 8 to 11 weeks for your immunity to actually kick in. So those are all loopholes for you to get reinfected. And people are not paying attention to
But
that.
I mean, for me, the way I look at it, because I took the Pfizer shot within 3 weeks. Okay. I think a lot of what you're explaining, it boils down to just people being very irresponsible. You take one shot one day and then you feel like you're invincible. Especially we're talking about a disease that or a virus that people still don't have all of the answers for. So the biggest thing they can tell you is to wear your mask. Take your shots, but wear your mask. So after they take one shot and then they're out there living their free life. The other thing that I'm learning is that the post-COVID health issues that people are having. And my thing is it worth it? Take the shot, minimize the severity of you when you get this virus. That's number one. And number two, for the people who didn't take the shot, who actually got the COVID virus, there are a lot of things that we're hearing now that they are experiencing. There was a guy in the States, one of my auntie friends, he had COVID, I think like 3-4 months ago, and he's still having the same symptoms over and over. He is sick. So there's a lot of post-health issues that apparently coming up. So during this time frame, again, we are going to be seeing a lot of things until there's a long enough time for the scientists to go ahead and have good samples to be able to give us something that we can say, okay, I can live with it, this other explanation. But as of right now, people do need to wear the mask. I took my shot. I'm still wearing my mask. Yeah, I'm still scared. Maybe it's also because I'm a hypochondriac as well, but I'm still wearing my mask. I'm asking everybody that I'm around, you not take a shot. You take a shot, you can come around me. At least if you took your shot, I feel a little bit safe. But nevertheless, I think there are just so many people being irresponsible. I wanted to ask Dr. Cooper this question. There's a question on the chat. Has there been any updates on fertility issues? Initially, women vaccinated were experiencing complications with menstrual dysfunction. I never heard that one before.
Really?
What she
What's
said?
not functioning properly?
No, you know what? I could probably say something to that because, yeah, I should have talked to my doctor about that. But when I took my Pfizer shot, all of a sudden, yeah, the menstrual part of it
thing, yeah, some of us at that age where
showed up.
the menstruation cycle is they're doing different things on
It's
its
already
own.
abnormal, but it showed up like after I was done. Like maybe 2 days, I went 2 or 3 days. I went and took my first shot. Boom. And I felt that I think the vaccine had something to do with that. Full blown. Yeah.
Dr. Cooper?
Yeah.
So I would like
Do you
to
have any-
just talk about one thing that Claude had mentioned about full immunity coming on 8 weeks after your first vaccine. I think more accurately, it's 2 weeks after your second vaccine. But when your
Yes.
second vaccine is,
No, I
depends
mean,
on which one you got.
let me, yeah. I
So
mean,
if you got AstraZeneca, then 2 weeks after your second vaccine would be 8 weeks after your first vaccine. But if you got Pfizer, then 2 weeks after your second vaccine would be 5 weeks after your first vaccine. So really, it's 2 weeks after you're fully vaccinated that you start to see your immunity, coming up.
Yeah. I meant that, the space between the vaccine should be at least 8 weeks for you to be able to get the benefits of both doses.
But that
So
is
Nicole, will you be able to actually answer to the menstrual dysfunction?
Honestly, I have not heard about this as a side
Really?
effect.
That's
I have not heard about this as a side effect.
very
Especially
weird.
not as a common side effect.
Yeah.
I've not heard about that.
That happened. I kind of expressed that into my doctor, and she said, "Well, Rabina, I'll document that because that could be,
So
I have heard and read a lot about it with women in menopause that receive full blown menstruation, and then the other way around, women that were menstruating that just ceased, menstruation. I have seen read stories on that.
So then that could be. Oh,
So
thank you for sharing that,
there
Claudia.
haven't been enough data yet for it to be, a scientific study or to be confirmed. But these are all just reports from different places, from different health centers.
Yeah.
So it has not been made profound yet as an actual.
So we're documenting it because if I told my doctor, and
What about pregnant women? Is there any
It's
issues?
highly recommended.
Okay.
Highly recommended for pregnant women to get the vaccine. Okay. Highly recommended for pregnant women to get the vaccine. There's so many complications that arise in pregnant women if they get COVID. It is highly, highly recommended. One thing that people don't realize is, first of all, just from the physics of pregnancy, you have, obviously your abdomen is much larger, which puts pressure on your lungs already. Normally, you don't notice it. Some women may notice it when they're trying to go up and down stairs. They get more short of breath because you're carrying this heavy load in front of you, it's pushing on your lungs. But now imagine sick and they're being pushed on. Pregnant women can do very, very poorly. If they get severe COVID, it can be very extreme and it can lead to ICU stays, emergency C-sections, trying to have life-saving procedures. So it's really quite advisable for pregnant women to actually get the vaccine.
Yeah, I heard they're taking
I have another question here, Dr. Cooper. Thanks for what you're doing in Liberia. Will you be partnering with the Ministry of Health on wellness issues in Liberia, as in doing seminars and teaching community leaders on the importance of health and wellness?
So that is something that we do through the Healthcare Federation. As Salamartu mentioned earlier, the Healthcare Federation of Liberia is the local branch of the Africa Healthcare Federation. So these healthcare federations exist all around Africa to bring together the private health sector within that country to collaborate amongst themselves to sort of improve their own efficiency, but also to collaborate with the government on things like that, on training, on standards, on creating a business environment that is nurturing to private health sector to allow the private sector to flourish and create better standards and improve access. Because especially within Africa, where we have a lot of budgetary constraints on government, it is not realistic to believe that any real African government can provide all of the health care needed for their population.
Yeah. And you actually did some training, I remember, during COVID, the Health Federation of Liberia. You guys conducted a lot of training.
Yes, we did. We actually did a virtual training for most of 2020 on infection prevention and control for healthcare workers. So especially during the lockdown, when we could not gather as groups, but that was when it was so important for healthcare workers to get trained on how to protect themselves, how to wear their PPE, how to clean up the facilities to make sure they don't transmit COVID. We actually worked with the Ministry of Health and worked with NPHIL to get WHO lectures and adapted them to be a virtual lecture. So you're watching the slides, you're hearing the content behind. We had them online to allow healthcare workers to sit at their homes, at their offices, to learn and to go through these lectures and get the training that they needed. We also opened up facilities where they could come use a tablet if they didn't have Wi-Fi, they didn't have a device at home. They could come use the tablet to go through the lectures, did a pre-test, did a post-test to make sure that they were actually learning, and gave them certificates, also gave them triage sheets. So yes, we have been collaborating already with the ministry and with the government.
Now, Dr. Cooper, I know recently there was a lot of talk about mixing of vaccines. People got nervous because they said they ran out of AstraZeneca and Johnson & Johnson was coming, and they should, you should take would you advise, is that advisable? Is that something that you can do? Mix the vaccine? Any one of them?
Okay, so yes and no. So between AstraZeneca and Johnson & Johnson, no, you cannot mix one. If you start with AstraZeneca, you need to finish your AstraZeneca. Johnson & Johnson is only one dose. So there'd be no advantage of taking a second dose after that, right? So AstraZeneca, if you started with it, you finish with it, right? Johnson & Johnson is only one dose. Same goes for Moderna and Pfizer. If you start with Moderna, you don't switch over to Pfizer. If you start with Pfizer, you don't switch over to Moderna. However, those are the two groups. AstraZeneca and Johnson & Johnson are brother and sister. Moderna and Pfizer are brother and sister. Within those families, you don't mix. However, there are new studies of mixing between the families. There are studies happening in Europe now where you may be vaccinated with one dose of Moderna and then go over and take a dose of Johnson & Johnson from the other family. And those preliminary studies are actually showing that type of mixing gives a much more effective protection than staying within the family. So again, recap. Johnson & Johnson and AstraZeneca are one family of vaccines. Moderna and Pfizer are another family of vaccines. If you start with one family member, you don't switch to another family member. You stay in that family. But mixing the two families, early research is showing very, very effective, more effective than staying within your same family, actually, of vaccines. But there is no official WHO recommendation yet to do that mixing. There are just a few countries who have started, and kind of in a trial phase. They don't know yet what will happen with side effects and those types of things. They don't know if you get the worst of both sides in terms of side effects. So it's not yet officially recommended, but there are early trials coming for that. That is a general thing I just described. In Liberia, do not mix. because we only have one family. We only have the same family, Johnson & Johnson, AstraZeneca. In Liberia, do not mix. If you got AstraZeneca before, more is arriving in the country this month. Just please wait and get your second vaccine. If you haven't gotten anything, feel free to get the Johnson & Johnson. Or if you want to wait and get 2 doses of AstraZeneca, that's fine too. But do not mix those two. Please don't mix those two. We don't know what will happen with side effects. And what we do know will happen, it will throw off the numbers of vaccines available for people who needed them.
Yeah, that's a good point. Okay, ladies, any more questions?
No, I'm good.
Now, where can people get the vaccine? I know there are several health facilities that there's a flyer that's going around that have them. I know SOS Clinic, of course, JFK, what else? Catholic Hospital, SOS Clinic, JFK, Peace Island, ELWA Hospital. Where?
So there are 40 facilities that rolled out this week.
Mhm.
Those are the 40 facilities that were originally vaccinating for COVID-19 with the first batch. So they are starting off immediately with the second batch. More facilities are going to come online. Wellness Partners, for example, is planning to come online. There are other facilities that are planning to come online, but those 40 that originally were giving are giving again.
Good.
There's a whole list of 40. The Ministry of Health has released that list. I think you can get it on the Ministry of Health's website and definitely on NPHL's Facebook page and NPHL's Instagram pages. You should be able to get that list, that flyer, apart from the fact that it's circulating like wildfire in WhatsApp. But if you need to go and look for it, Ministry of Health or NPHL's pages should be able to give that to you.
Okay. Well, thank you, Madame, for joining us. Very informative. I think we've learned a lot. I definitely will go ahead and, of course, not only share the information, but we will post it on the social media page. And I'm urging everybody to go ahead and use their personal social media pages to post the information. This video, of course, will be up by tomorrow. So let's share the information with our network, and we need to get people vaccinated. That's the goal.
And wear their masks.
And yeah, wear the mask,
Social
distance, all of that. So, but thank you so much for joining us tonight. And again, please let us know how to get in touch with you.
At Wellness Partners Health on Facebook, on Instagram, on LinkedIn, Wellness Partners Health. And keep an eye out because we're actually, every Monday, we post health tips for our Medical Monday. So we're doing a series on COVID-19 right now. So stay tuned tomorrow for Medical Monday on COVID-19 topics. For the next few weeks, we'll be doing COVID-19 topics. Wellness Partners Health on Facebook, on Instagram, on LinkedIn.
Thank you. I would love to have you back for, what's it, a high blood pressure month? I think it's in May. You were so grateful. We're so grateful to you for actually even showing up to the temple to speak with the members about high blood pressure, hypertension. So thank you. Like I said, this young lady is working hard. She's everywhere. She's working hard.
Speaking of which, Salamartu, if anyone would like to do health fairs, would like to collaborate, needs a health center to come out and do things like blood pressure screenings, please reach out to us. info@wellnesspartnershealth.org.
Thank you, Nicole. You're up.
So let us know, reach out to us. We're happy to come over. We went over to up the hill, as they say, to do blood pressure screenings.
Up the hill and nothing happened to her.
Up the hill. Oh, they asked you it.
Went safely.
They asked you.
No, but it was good. It was good. And I wasn't here, but thank you so much.
I think
so. We will let you leave before we.
Thank you, guys.
Thank you, Nicole.
All right, thank you.
Bye.
Bye-bye. All right,
Good
ladies.
stuff.
Well, that was fun.
Good stuff.
Friday was in her element, that her own era over there. So
I know, right?
her era
Oh,
over
but
there.
they calling
So,
her.
yeah, now we sort of kind of running out of time. We really wanted to talk. There was a couple of other issues that's been happening in Liberia topic. I don't know
We
which
can put
one
them for later.
to jump on, or
Mhm.
maybe we can talk about it next week because we
Yeah.
literally ran out of time. But of course, the hottest topic that people really wanted to hear about was this social issue about dating your ex.
Oh.
Yeah. Now,
If you're dating your ex, sis,
dating your
sibling.
ex, huh? Not just dating your ex now. So the backdrop on this topic was following that movie,
Where
the
you got it from?
Resort to love.
Resort to Love. Yeah.
Mhm.
There was a movie recommended by the same Lavetta. She recommended
Where
Lavetta
is she?
recommended this movie, and it stars Christina Milian,
Milan.
the singer. It was actually directed by Alicia Keys. But and this girl, her career, she's an aspiring singer. Her career is up the creeks, and she just broke up with her fiance. So she goes to this resort in what was it? What's the island? What's the country? The African country?
Madagascar or somewhere.
Madagascar? No, it wasn't Madagascar. Well, she
I
goes.
said, what the name of the thing?
Jesus.
She's on
But
here.
anyway, yeah, she goes to this like remotely far away African country, way down there somewhere. And what are the odds when her ex-fiance shows up to get married in the same place? And she's first thinking about getting back with him, but then she meets his brother, and his brother, I was watching the show. I was trying to figure out what that boy was, who he was. He's so fine, but that's the same guy from Power, Sean. Sean that got killed.
Oh, Sean.
Power.
So she didn't know the boy?
Well, she didn't know that was his brother. So in a way, she hit it off. And end of the movie, it's a spoiler. She gets with the brother. So the question is, one, would you get back with your ex? Or two, would you date your ex's brother or close cousin? I say, hell no.
No.
I say, hell no to the
You're ex for a reason. You're
but getting back with the ex,
reason.
that's a different story.
Yeah.
No, I could do that depending on
Do what thing?
Get back with the ex.
No, you can get back with the
You
ex.
left the
That's your
person because
own
of
story,
something.
but that's not the issue. The issue is dating a sibling of your ex.
Yeah, that's my problem. That one,
yeah, but you got two parts. Okay, wait a minute. You have.
But let's deal with the first part.
Yeah.
Would you date your ex? I personally, I can't think of any one of my ex that I want to date.
Exactly.
However, if the door isn't completely closed, because the ex come in different situation now. If you're in an abusive relationship, no. But there's sometimes, you're breaker, then you'll get bad, then you're breaker, then you'll get.
No, that's too much work. Yeah, you just let it be. There's too many things out there to explore than just subjecting yourself to this, and then then something happens again. No, man, that's too much work.
No, but when you reach that stage where you have identified this person to be your ex, it's not like you're fighting for 2 days and then you're trying to make up.
Right.
It is
build up.
Sometimes there has been some time lapsing. Probably you have gone on your way, you have had some one night stands or some flings here and there, or you have re-established yourself somewhere. So putting that definition as an ex there and then coming back for it, what did you lost then?
Right. But again, let me clarify.
Right. Come back.
There is no ex that I would like to, as of the day. There's no ex that I want to get back with.
Yeah, but then you would not take your ex, man.
No, but
if you broke up, then obviously there were things that you did not, come along.
Yeah, can you check that?
Okay, maybe at that time you did not have any direction in your life, so I don't think you will make it.
Or
And
could
then,
it
you know,
be?
maybe if you see the person 2 or 3 years later, you're like, oh yeah, you know, you got everything
Yeah.
all settled up, you
Yeah,
live
you're
very nice
older, you're
now.
much older.
Yeah,
Mm.
yeah. I mean, that's a decision, but I don't know. Milk spill is spill. It will be
Yeah,
yogurt
you
for the
can't go
rest
back
of
and pick
yeah.
it up again. You can't pick up spilled milk. Let it go.
But with the
Yeah.
sibling,
Yeah, the sibling now.
that's a serious issue though. You know, considering the movie where this particular sibling, she had only heard the name, but she didn't even know. I mean, it was
She
just
ain't know.
random. Okay, but
Mhm.
obviously she got to know because he told her that, oh yes, that's my brother. They
Yeah.
all had the introduction. And then she still went and decided to fall in love. I mean, she just wanted to fall somewhere, I guess.
But did he have
A bad
similar
point.
characteristic like his brother?
No, they were extremely different.
They were
Really?
different
They were
characteristics.
very
So
different.
this brother was a part of the married and he retired. So he was way away from family for so long.
Yeah.
So it's just one of those relationships where you know that your fiance has a brother who is stationed somewhere else, but
Yeah.
you've never really met him or seen him before. So her first time seeing him was, you know, this random meet
Yeah.
on this island, and he wanted to talk to her. But then, like, you know, a few hours later, then he realizes that she's his brother's ex. But that doesn't stop anything. They still go on.
So how long? Okay, I have a question. The gap in between when they broke up until she went to the island. What
A
was
year?
that?
Yeah. Yeah.
A
So she hadn't
year.
been with anybody. If she
My
didn't
thing is, not even
have
problem.
anybody that she was.
The issue
No, but what
is,
I'm saying is that that chick could have been on the rebound. I mean, because so now you break up with somebody. There's a lot of factors.
so
I
you
would
see
I
No,
would
she
nobody
date
didn't
to go
realize it was
eyeing
not
for
a
her brother?
rebound. It wasn't
You
a
said what?
rebound because she had the opportunity
That's what I'm
to
trying to
understand.
understand.
Yes, she did have her closure. And she
Okay.
did realize that this fiance, this ex-fiance, wasn't really what she was looking for.
So
Yeah.
she was ready for a relationship, and it just happened to be that she met this guy, but she didn't know that was her ex-fiance's
No, she
brother.
knew at
She
that
found out
time.
very
She knew
early
at
Oh
that
on.
no,
time.
that get no.
She knew
No,
at
she
that
has no
time.
agenda.
She
She
didn't
knew at
know
that
him
time.
before. She didn't know the
No, I
brother
don't watch
before.
movies, Lavetta.
Yeah.
I'm not a movie person. I'm not a movie person. I'm sorry.
But my question is, because you give me a lot of scenarios, so that means you would date an ex-sibling if the scenario kind of fits what you're comfortable with. I'm saying I
No.
would never.
No, I would. It's Matu is no. That's no. What? And you were the person fiance? You that was her fiance, Matu?
They
No.
were dating for what, 4 years or more?
No,
Yeah.
that's just totally out of the entire.
Yeah.
No, you don't do that.
not.
That's
So let me go
no.
through the comments. I see
No.
folks saying,
Nasty.
People have, yeah, you know, there's certain
I tell
things
you,
that
yo,
you
man.
can't do that. You can't do that.
That's
Like I said,
nasty.
very no, this, yeah. Oh God, Matu, really.
I don't know how family dinners be like. Yeah, you see I see my ex siblings.
Yeah,
Like, my sibling.
dysfunctional. Mashed potato be everywhere.
Well, now, so we are talking about dating the ex, and of course, Charlene should not leave her.
Check yeah on the show. I can't tell you who got teeth. Why you there?
Should not leave her
Why you
whatever
miscarried?
what she was doing.
She said you should let her eat, let her can't talk. Echo.
Yeah, so that the one that she wants to. Hi, Charlene.
Charlie just didn't
Carol,
want to
waiting
be
for your
political
info. Wait,
today.
say.
What you want to say? That the one
Please
you
come on
want to.
camera so we can see you.
Charlie didn't want to be political today, that's all.
No, she coming talk. Where you huh?
We were talking about vaccines. She said no, she won't hear that one there. We talking about
Because
the police brutality. She said no, she won't hear that one. We start talking about loving ex. Yeah.
But where is she?
Y'all can't talk now. You in talk.
Carrie, what you say?
That boyfriend business gonna say her.
Yeah.
The man moving the
Man, laugh
mountain.
at.
The man moving the mountain. She go.
She go.
She'll come back. She said we should let her in.
Yeah, I did. So
No, but I mean on a serious note,
That's
it's
nasty.
quite
Yes,
it's
Moya,
quite
you what you
common.
say? Unmute yourself. She no. What kind of internet you
That
got?
now
So,
I like pure internet. Oh. That now I
no,
like
she
pure
not borrow
internet.
internet from somewhere. Wait,
That you not
please unmute yourself.
here. Are we
Oh,
discussing dating your ex and his siblings?
yeah,
Yeah,
ma.
that the
I
one
want
you
to say
can
my
come
dog for
for.
the man, his brother.
Okay, first of all, if you want to date your ex, date your ex. That's your business. Nobody should ever be involved in how you date your ex and who determines when your relationship ends, right? That's my take on it. And also in regards to his or her, hell no. There should be boundaries on dating
Yes,
your boyfriend, his ex, his family, his brother, his sister, his cousin, his friends, and
his
also
best friend. Right,
yes, and besides that, you should also not be dating your friend's ex. There should be a code that
right,
we
Yes, yeah.
all
Really.
all be able to be able to abide by. Like if your friend has an ex or has a boyfriend, that boyfriend needs to be your brother or your friend or whatever the case may be, because I think like friendships should be more important than these sexual relationships, because at the end of the day, yeah,
Here,
No more
Charlie,
panic on the side of the
It's
road.
not
internet,
I like pure, yeah.
internet, you got so no shit.
The thing,
Where you at?
the thing about friendship is when it comes to that, I like to define what the friendship is. I like to define what the friendship is, because I did have a similar problem like that years back with somebody that I went to school with. The person said I dated their ex and I'm their friend. We were in class together. You are not my friend. We didn't go for recess together. You know, you are not. Yeah, I wasn't going to your house. You know, we didn't have it like that.
But I wasn't a friend. I was
Y'all
partner
were
and
in the same
associate.
class, sitting
We
down.
were in
and
the
they
same
say,
class, so that does
oh,
not qualify us as
Yeah, no,
friends.
that's not
So
friends.
right.
in those
No,
instances,
but you know
the
what happens?
definition of
What
friendship
happens
is
is
very important to me.
whoever is claiming to be the victim, they always classify the relationship to be more than what it is, right? So
Yeah.
whomever is now the villain tends to be the person who is obviously the person who's going to say, I didn't know her that well. Me and her we didn't go to school together. We don't know each other. We're not family. So there's always classification on the relationship. So you got to determine what makes sense to you. If this person is actually a friend of yours, obviously their boyfriends, their husbands, their whomever have to be off limits to you. Now there's some people who you meet in passing. Like you could meet somebody and say, okay, we know each other. I know your name, you know my name, but how does that make me loyal to you than loyal to my feelings? So you got to kind of like play it. You got to weigh your options. What makes sense and what doesn't make sense, and how you feel that's going to benefit you. And at the end of the day, it's about it. It has to be beneficial to you as an individual, but we still have to play that fine line with the girl code, right?
But some of us, okay, in fact, growing up, okay, so what
Let
age
me
do you
say, the better
consider?
thing, what if your friend's ex is who God has for you? How you know that the only
But
person
I can,
God
let me
decided to
no,
get all
let me
the
say
other men
something.
there, God decided
But let
to
me
take
say
your
something.
friend full of men and give it to you?
Okay, so what do you consider as, because, okay, we were all teenagers, like I grew up in a little town with a whole bunch of people that knew each other, okay? Then there was Monrovia, but then the war or whatever happened, everybody left. So there were people who dated people. What do you consider? Is it after third grade? Is it after fifth grade? Is it after 10th grade? Is it after 12th grade? That you would say to yourself, oh, you know what? This person and my best friend were going out when they were in 7th, 8th grade. But then in the future, I end up with this person, even though that was my friend, 10th grade or 11th grade boyfriend. So how are you being selfish? Are you not loyal to the situation?
You know what?
Because
I think
I will tell you
sometimes
something. I will not be ashamed to tell you today. There was somebody who was growing up.
Don't call no
Yeah,
name, yo.
somebody who was growing
We
up
got
and
lawyers.
something happened. The people say, oh, every time they come, they say, oh, money can, money can. So my friend and I, one day they put a ball in his spot. The boy say, I want you. I said, okay. I'm back to borrow, I will answer you. All my friends, I'm like, So I said, I said, no, I'm not with you. But then somebody in the people went around, well, the boy say he did it, but say he did it's sweet for you. You went there, then you listen. So everybody talking, and he still know the other person, well, the person. So was I supposed to be first with the person now? Even though I was small around, I was supposed to be first with the person, but we have, you know, so it depends on where you are. But I see as adults, that's you don't do that. You don't do that. There are boundaries. We totally understand now. We in the pool of dating, and we understand that you know you can't do that to me, and I can't do that to you.
Yeah.
So
I think sometimes we can be too free with the word friend. I
Exactly.
think that's part of the
yeah, but
problem.
as you grow, you will learn.
Yeah, I knew you in 3rd grade, 5th grade, 6th grade, 7th grade. We've in our 40s,
Met
we
at
not
parties
both,
before or
yeah.
something,
And you come and tell me
Right.
you're kind of small girl, loving business that you were writing notes. Do you like me? Do I not like you?
Yeah.
That's
But
not
there are
big.
also
Yeah, I
other
think the
situations
person.
where
Yeah, no, I think sometimes we
there are
can
also
use the
other
word
situations
friendship
where
to
this
boost.
person, you know, people, you don't even know that these two people were ever dating before in your life.
But that's the other
You
thing.
only get to know
Yeah.
because
Yeah.
yours has come out. You know, those
Yeah.
are all different situations. So if somebody is supposed to be your friend, how come I don't even know you dating this person that you
Right.
told me, you know, is your
Right.
ex now?
You remember?
How come I didn't know. So for me, friendship is something that you really have to define when you're talking about, you know, all those things. Because
I'm reading some of the comments here. Look,
Lavender and
Dr.
gossip,
said,
you know.
friends, acquaintance, colleague. Yeah, define mom.
Categorizing.
Define it.
Yeah.
Define it.
I know of a situation with 2 sisters where the boy actually wanted another sister.
Oh.
And then the smaller sister decided to come in front because she felt she was more prettier. And after a while, the boy told her that no, now
That's
you
a
are
situation.
one with the other
Easy.
yes.
That's really a situation somebody can't handle. I see James saying X only applies if that type of, he said X only applies if you were married to the person. Dating is dating. You are not a hostage.
Exactly.
There you see, so
if you
so
like
the,
it,
men,
you
so
like
the male has a different version of what they think, you know.
Yeah.
See? So it's a fine line between the two because men they think something differently.
I think
but
the
a man like for another man to date his ex, what he doing?
So look, ladies, for me, I have a thing, right? I don't want nobody dating my ex. I don't want no friend of mine dating my ex. So because of that, I have limitations on me and my friends. So as long as I call you a friend and we have that friendship, I will never overstep those boundaries. Like that guy automatically becomes my brother.
Yeah.
And because I see you as my sister, I'm never going to overstep those boundaries.
Yeah.
And it's not so much because of you, it's because of me.
Yeah.
Having that
but
respect for yourself. What happened? I'm going up.
No, yeah, sorry.
But
I think no. You know what? Robina actually had asked a good question because the same. I think guys kind of look at it very differently.
They do. They do. Some men will look at it differently.
Yeah. So the men who are on here, they're talking plenty. But would they want somebody to date their ex?
So when I like it.
I didn't say that you should ask the person for permission. Why would you ask someone for permission if you are not married?
They will tell you, yeah, go ahead. Y'all can do whatever y'all want to do. But in the back of their mind and in their heart and all heart, they don't want nobody dating their ex.
A real man would not like it and he would tell you, I don't like it. Period. It's the maturity level.
Most men sit down think in the back of their mind they will rewind that situation and they will be able to get
Lavetta
that.
The first thing they would think,
But Lavetta
In
said,
case their friend, yeah, why their friend was with it, as their friend was already not correct. And you know that. I mean, there are a lot of different scenarios because obviously you have the person that, oh, you know, my ex, and I know that you are with that ex that you are not correct.
where y'all with that? Let me read some of the comments in the question here.
please
So
do.
Lavetta
I
said,
want to hear it.
so if you date 5 men, all of them are off market from your friends? Yes.
Who are you to be dirty plating like that?
Yes.
And they say maybe say
Let me
hi.
respond to Claudia really quick.
No,
Claudia?
on a serious
Claudia.
note, on a serious
Wait,
note, right?
Charlene has a question for you, Claudia.
Wait, no, let me learn first, though. Let me learn on a serious note. You
Let me
have to
answer you.
define what friendship is. You have to define what
Yes.
friendship is. If it's somebody who is your acquaintance or you just know that person by name because you kind of live in the same, you know, society, that person is.
Or y'all have friends in common.
Oh yeah, yes, which is usually
Yeah.
the case with Liberia.
Yeah.
You probably everybody are royal, so you consider
Yeah, and
everybody
they say,
your friend.
when they say hello, they sit to the table, then therefore they're your friend. Then you might not date the. How big you are.
Second thing is, what was the status of that relationship? Did you have a one night stand? Was it just a fling? Was it an
You're
actual
considering a
relationship?
relationship.
We have to get it because some people they can just be eating something from time to time and they call it relationship. Not a relationship.
Right.
You're not even in the public. You're not known nothing. You know, you're just on a power. You're like that. Then by the time something happen, boom, you say, "Oh, that relationship." No, you have to define that one too. What are that
Right.
relationship? Or that just eating something like you got the side squeeze. You gotta define that one. So when you got all those things under the thirdly. If it is not secret, sometimes if your person is your friend, the person is supposed to know who you are dating.
Claudia, if you go to fourth, they will not accept it.
No, that was me. The person is supposed to know who you are dating. So if you consider somebody your friend, obviously that person should know who you are dating.
Yeah.
And when I mean dating, that I mean you should just be doing concert with the person. You should have.
No, that I agree with.
So
If
the
you
person
dating
know you
somebody,
got a
we might know
relationship,
about it. If we know about
Yes.
it, then
so
the person
if
will
you're doing
step there, then
secret
you
part
come
with
up
the
with
stuff, then you cannot blame somebody for something later on in the future. Yes, everybody is grown, so you have to decide
Okay.
which side you want to stay. You want her or you want Zeke. When you decide,
Okay. So Claudia, you made a comment earlier. You made a comment earlier that if somebody already not correct in their relationship, then how do you decide that, or there should be no boundaries on somebody who not correct in the relationship?
no.
Wait.
But I what you said.
Okay. What you say, Claudia? So I can answer you.
I said, if you want to date someone, and you find if this person is accusing, if this friend is accusing you of dating the ex, and you fully know that this friend who is making all this drama wasn't correct to that ex, that means they were not in an exclusive relationship or it wasn't anything serious.
Okay.
That's a different scenario all by itself.
Let me answer you.
Kara, where you coming from?
No more disclaimer needed. No more disclaimer needed. So if that person wasn't correct, then now your position to decide if that
They
person
were
was
making
correct
their
or not
position
correct.
to decide who are dating.
That was that man in that relationship. Your position to decide who correct and who not correct. And I'm not saying you, Claudia.
Then the person is disqualified for talking about what is correct.
Your friend and their relationship. No,
then the person is disqualified from talking about what is right.
But okay, so let's go on to some
No,
questions.
because the thing is that if you didn't
But let them
respect
talk
your
first.
relationship enough to keep it seen, why would you be angry if the person decide to date someone else who you friends with or who you know? That's a different thing. You get no right in that one because you're not correct yourself. But yes, so you can't even talk inside that one. Yeah.
Okay, so Clara, you're saying because you didn't know that it was your friend's lover or whatever, and it was never talked about. So if the person comes to you,
if you see somebody you like, if someone is your friend, you will know who the person is dating.
Exactly.
If you don't know who the person is dating and you find out after,
then you're calling them friends.
Yes. there is it's irrelevant. Because if the person claimed that they were your friend and they have that respect for you, you
They
would have known who
said
was in their life and making them
Yeah.
happy at a certain time.
But then, so that tells you that the person wasn't sure if they were in a relationship with this person or not.
Exactly. So
Okay.
you're doing secret pass. So if you're doing secret pass, that means you won't claim. Okay. So that means you can't hold anybody.
So let's answer some of the questions. Yeah, let's answer some of the questions then now. So Tabitha said you want to know what does eating something mean? Oh, you know, yeah.
Who's that?
Tabitha said, what if your friend never liked the guy and has a very nice person? She left him a few years ago. You see him and fell in love. Now your friend married and you are single. Will you stay? It's because of your friend. The what you asking here?
No, this is a very common scenario. Movie-ish.
Like it's very specific to somebody.
No, it's a common scenario.
Is it the one man? Is it the one man's trash?
You
Is another
say
man's
because
treasure?
he's a friend X, so you can't date him.
What?
Okay, apparently, so your friend was dating this guy, right?
In college, say in college.
Yeah, in college they were dating, right? But she never really liked the guy, right? But he was a nice person. We all know that story. Oh, he's nice, but you feeling him. But you were sort of dating. So your friend, the friend leave the man and go marry somebody else years later. You're still single. You meet the guy. Is he off limit? Your turn.
No, in that situation, me and this person were friends. I'm obviously going with the first thing. As soon as the person tells me say they will be, I'm coming to you straight. Whether you marry or not, I'm going to you straight to tell you say, oh, you remember Johnny Brown for for junior year college, you were dating. I came out crossing and so and so and so.
But are you asking for permission or you just
I'm telling you. Now, based on that conversation, depending
you made
on
a
how
decision.
I feel, I'm going to blurt everything out and tell you, if you have an issue with it, we handle it right there and we squash that.
Yeah.
But you married now, you're left going, I'm single.
No, but I said no. I married, I got my husband. I said no, I want you to date him. No, what thing?
How are your sugar lower?
No, but I mean, it's just, yes, defining friendship and having clear conversations is very important in these kind of cases. You know,
so then so you're trying to say, okay, so if it was college, right? And the person I can see, yes, because it's college level and you respect your friend. So you go and you tell your friend about this person, you know? So I can see whether, but if you're talking about somebody in high school or whatever, no, don't try.
So we're saying time too now. We're saying
yes,
that there's a time determines if you talk to them or not. That's one.
Defining the friendship.
And then what my thing is really one is the friendship. I think we really use that word very loosely.
Yeah, do I respect my friend?
Yeah, that one. I know who my friends are, and I want none of the people there. They all know that brothers to me. Yeah, I mean, like it just after they introduce you to this person, they literally become like your cousin or brother. That's how you look at it. Yeah, that's one. Yeah. But there sometimes there's a situation where you are in the same circle. You don't really. I mean, it could be like, you know, you're in the same circle. Maybe my friend, the person who I look at as a friend, is a friend of somebody else. So that other person seems to come around and therefore they know me. I'm my friend. They're not my friend. Yeah. However, I will say a lot of, I will feel uncomfortable dating the person. But anyway, yeah, Tapia say, Claudia, I'm gonna tell you, you're not correct. Too much analysis. You're analyzing too much. Who is the judge and the jury of the state of relationship? Let people live and move on. You ain't. He worse than poor. But anyway, no, this is a
somebody use it. No, but I mean, you have to define friendship. But when it comes to siblings, dating the ex, your sibling ex,
that's just gross.
That is just a dead no. You know, what are y'all separated at birth?
Oh,
you
God.
know, that is just no. I
No,
know it's
wait,
summer.
hold on. No. It was
Wait
separated
now.
at
So
birth.
what is two brother than Fana?
They know each other,
Oh,
yeah.
but I find you a ear.
But all you want to eat, want eat.
Okay.
No, but I know it's
They-
common. Like there are people that would date somebody in Liberia, and then when they move to America, they start to date someone else, and then they realize that the two boys are cousins or something like that.
Yeah, if you close, I can't do it. I'm sorry.
That they
Yeah,
allow
but
I
what
had to
happens
sit
if
with
you
the two of
already in the
you.
middle of it?
Mm. Well, anyway, ladies, yeah,
Yeah, that's yeah.
nice.
So you know,
Lavetta
Yes.
has a lot of scenarios. Well, anyway, lady, yeah, I mean her scenarios, check on me. Yeah, what is eating? Please, before we leave Friday, please explain to Jim what is eating.
Eating something
Yeah,
to eat. You
he
eat.
know what eating. He want you to say it. This is a
You
Pick
eat.
Me
I
13
eat.
show.
If you know what
Knocking
eating is,
down.
then you're not
Eating
supposed to
something
have
mean
that in
knocking
your phone,
down.
my friend.
what is knocking down with a
So
car?
they log off right now.
All right, ladies. Well, it was
All
a
right.
pleasure
Thank you, guys.
tonight. I can't wait for next week. It look like what social these social hot topics these are the 10. Anyway, y'all have a beautiful evening. Thanks for coming in to come talk about this topic, Charlene.
Sorry I couldn't be here earlier, but
Where you
I
I will
coming
was,
let
from?
Paul know that you,
around. I ran away.
yeah, but I will let Paul know you
Got
showed
away.
up for this particular
No, that's
topic.
all you need alone. Yeah.
That part, past that level, with that part that you came back.
Yeah, she came for
All
this.
right.
All right, guys.
Bye,
Well, you
ladies.
have a nice evening.
Bye,
Take care.
everybody.
Thank you. Have a good
Bye.
week.
See y'all next week. Bye, Tina.
I will be going to Liberia sometime in December to drink pepper soup. Pepper soup. I want to test the mixture to stay in Monrovia. Drink pepper soup. Drink pepper soup. I love seafood from since I'm small, but I never eat this bitter ball. The Liberian told me so. Oh, pepper soup will have me on the go. I can't sit down, I can't lie down, I can't tie riding. I can't get away. I say, what's the name of this soup? Pepper soup. Man, it's tasting good. Pepper soup. Once you take a taste, pepper soup, you can't leave the place. Pepper soup. Once you drink that pepper soup, you can't get away. In Liberia, you have to stay.